Welcome back. So this image draws a clear picture of what it's like for someone who has glaucoma. It's a condition that gets worse over time and without treatment may cause permanent blindness.
Historically, the way to treat the problem is with eye drops, but anyone who's used them knows it can be a real pain. So here now with significant advances in glaucoma surgery is Dr. Paul with the Eye Centers of Racine and Kenosha. Great to see you again.
Thank you. Happy holidays.
Happy holidays
Welcome
to you
back.
too. This is such a common problem, glaucoma, right? Is it something that happens with age?
It is. As time goes on, there's a higher risk of developing glaucoma. It's actually the second leading cause of blindness around the world. So it's a very common problem that we face every day in our practices.
What is it? What is glaucoma?
So glaucoma is a condition where the nerve in the back of the eye becomes damaged. So like in a camera, we have the back of the eye, the light hits it, and the nerve, like a cable, connects the eye to the brain. So that nerve becomes damaged, and one of the reasons why is one of the main common reasons is the pressure goes up in the eye. Like a water balloon, the eye is hollow, and there's a natural fluid the eye makes. That fluid has to leave the eye, and unfortunately, the internal mechanisms that drain the fluid out of the eye don't function very well. So like a water balloon, it gets basically pressure builds up, and that nerve becomes damaged.
And what's the traditional treatment, Ben, for glaucoma?
Yeah, and the mainstay, so we want to bring the pressure down, and how we do that is by using eye drops. And eye drops are great, they work very well, but the problem is, cost, side effects of drops, obviously redness, irritation, dry eye can get worse with drops. People don't remember, it's hard to take it every single day of your life. And so compliance becomes a big issue. So drops are great, but then we also have a surgical option. And surgery, unfortunately, has risks with surgery. So we used to wait and wait and wait until the glaucoma was worse before we did surgery. But now we have this new type of glaucoma surgery called MIGS, minimally invasive glaucoma surgery. That's allowing us to intervene earlier to protect people, get them off of drops, because the safety is so much better than the traditional.
We're looking at this. Walk us through this.
Yeah, this is something called the iStent, which came out about 4 years ago. It's the first FDA-approved device in the U.S.
And that's
for
that
MIGS.
piece right there.
That
in the
small
penny.
1 millimeter piece actually goes in the eye. It's the smallest implantable device in the human body. And what's really neat about it, it takes 5 or 10 minutes. There's very little post-operative care, and it can help.
Well, and using this penny is your way of showing how small it is.
It is extremely small. People can't feel it, they can't see it, and after surgery, your recovery is very similar to that of a normal cataract surgery, even very little minimal risk involved. And
so this is normal flow, what we're looking at right now?
yeah, so this is flow that's actually reestablished. So the stent is in the eye right now, and it's allowing the fluid to flow out of the natural mechanism. So we're basically reestablishing the natural drainage system of the eye. So we're not falsely changing the natural physiology of the eye. So from a safety perspective, it's a lot nicer.
What type of patient is the minimally invasive surgery right for?
So for people who have early or mild to moderate glaucoma, so historically we kind of hand shackle people, say, sorry, you're not bad enough to have glaucoma surgery, so stick with drops, right? And it would be frustrating for our patients. So people have early, mild to moderate glaucoma, now we can go ahead and provide this opportunity to help get them off of some of the drops and then negate the need to the cost and all those issues that we face.
And in getting this approved, this device, because I can't get over how small it is, you were actually part of some of the studies, right?
Yeah, we're part of this study with the iStent. There's newer versions of the iStent coming out. We're part of studies that are also other devices that have been out there that are coming out. What's beautiful about this whole MIG space is not just the iStent. We have something called the SiPass, which is the one right there, a different mechanism, a way to get the pressures down, something called the Zen. There's another procedure called canaloplasty that can reestablish. So there's multiple new companies that have come out with different devices that can allow us to tailor the type of surgery depending on what's wrong with the patient, the type of glaucoma they have. So now we have much better approaches to treating glaucoma now.
It's unbelievable what technology can bring to these conditions. I'm curious what patients are saying about the minimally invasive surgery and all of these new options for them.
Yeah, no, it's great. I mean, for me as a glaucoma specialist, the best feeling I get is when someone says, Doc, thank you, right? That's how cataract surgery is so much fun, LASIK. Well, glaucoma, we can't make their vision better, we can protect her from getting worse. But if you can get someone off of drops, and they come in saying, doctor, thank you. I don't have to worry about taking it with me on my trips. I don't have to worry about sleeping at night going, oh my God, did I forget my drops? So that is a great feeling. So people are so happy being off these drops now.
And we're going to hear from a patient, right, who's in your office who had this great experience. Let's take a look.
And as far as the surgery went, it went great. It lasted 2-3 minutes and everything was done.
Wonderful.
I am very, very happy. My 3 months are up now. My pressures are down. Everything is good. No drops. Yay, no drops.
You can sense the excitement, right?
Exactly. You could sense it. I mean, for people who don't have this condition, no drops is a really big deal.
Yeah. I mean, think about it. I had a patient, a daughter of a mother, who she said, "Thank you, doc, because now I don't have to travel to my mother's house every night to put her drops because she can't do it herself." You know, so that it changed her whole daily functioning.
life.
Her life because of that one surgery.
Well, and I'm glad we're talking about glaucoma today. But and after visiting your office, it's clear that you pride yourself, but you're also very interested in the latest technology because patients are recovering so quickly, and it's minimally invasive often, and it really changes their quality of life.
Exactly, and that's the key difference. Now, I think as an ophthalmologist, as a community, as a eye care profession, we're worried more about quality of vision and quality of life. And so whether it's glaucoma, cataracts, you know, dry eye, laser correction, that's the issue for us is how do we maintain high quality of life for our patients.
It's wonderful. Great to see you.
Thank
you
you.
so
Thanks
much
a lot.
for bringing us this technology. You can have a glaucoma evaluation, or if there are any other concerns you have related to your eyesight, your vision, you can contact the doctors at the eye care centers of Racine and Kenosha. The phone number for a consult is 262-637-0500, or you can visit them online at amazingeye.com. Great. Thank you so much. We appreciate your time.